everyone. My name is Brady Maiden, and I'm the I don't even know my title, y'all. I'm sorry. I am the Community Science Program Manager here at the Southern AIDS Coalition, and I am joined today with our Public Policy and Advocacy Director, Will Ramirez. Whoop, whoop, whoop. So we're joined today not because it's just spooky season, so happy early Halloween to y'all who celebrate, but a scary topic, at least for me, y'all, that's been on my mind all this year, let's be honest, the last 4 years, is what's happening in this election. So I'm a little stressed, and so that's why I had to team up with Will, y'all, so we can really talk through some of the concerns and really some of the policy questions that I know a lot of you all have about how to navigate this election and just overall what we can do to connect with each other, really drive home our collective efforts to ending the HIV epidemic in the South and really just increasing our advocacy presence overall. So, with that, I kind of wanted to start off with an icebreaker. Will, I'm sure the folks already know you pretty well, but like, let's get a little deeper. So, go ahead, introduce yourself, tell us a little about you, and then also if you could answer this question. So, in a perfect world, what's one policy change you'd make to improve your morning coffee experience?
Man. Okay, so Will Ramirez, Director of Public Policy and Advocacy, Southern AIDS Coalition, pronouns he, él. So let's see. All right, so those that know me know that like to me, the intersection of public health and the built environment is like something that it's driven me for a very long time. It informs a lot of the work that I do, and it informs a lot of the framing that I take on, right? And with that, I think that the kind of policy that I would love to see on the federal level that would be like spread throughout the land, right? Would be mandating new projects, new developments, especially the ones that take on federal funding, to take on every single project with sorry, with the social determinants of health in mind, right? And as they're doing that, they're also like graded on whether or not they're attaining their goals to be able to keep that, right? So, mandatory integration of the social determinants of health into urban planning. I think that would just completely change the landscape, right? Because if developers are taking into account what kind of impact their development is going to take on local environment, the environmental quality, transportation, local foods that are available, economic opportunities for folks, and then whether or not the way that they are building is it healthy for folks in the community, right? If all those things I think have taken into place, and there's certain programs that already exist like that, but never so fully integrated into like every single project that gets created, right? So to me, if that were to happen, right, and it sounds super wonky, but if that were to ever happen, that would be something that I wake up smiling to every day.
No, that's not wonky at all. Like my little coffee treat, or I would say the sweetener in my coffee would just, be to have bodily autonomy, reproductive justice, y'all. Shout out to my vulva owners. But yeah, that hit it. If you just,
Right.
if you had the planning even to your scale, we would have reproductive access and housing access. So all of that would come together. So no, I definitely appreciate that. And that's something like to think about for sure. So with that, thank you, Will, for that response. I feel like we should just like go ahead and like let's just dive on in. So I wanted to hand off, you know what I mean, the mic to you so you could really walk us through your presentation and really let's have a discussion on overcoming regional barriers. So that's empowering CBOs, local health departments, and individuals to really drive change in public health. So with that, I will pass the mic to you.
Thank you, Brady. Let me go ahead and do that. Let's see. All right. So as Brady said, the presentation is overcoming regional barriers. A little bit of background on this presentation. This was originally given to CBOs and local health departments as a way for them to basically find better ways to collaborate with each other to address specific issues within their communities, to engage in advocacy at whatever level that they can, depending on their capacity and whether or not they're allowed to. Um, and in essence, that was the birth of this conversation, right? The birth of this presentation. But we wanted to kind of like retool it for individuals, what would it look like for individuals to be able to take in some of these lessons, and what sort of outcomes would they create, right? To become better advocates, because we know that this movement, these efforts move with people, right? And getting individuals involved, and how for them, how they can get involved, and then also how can they become better advocates is extremely important. So because this was originally given to public local health departments and CBOs, it took the viewpoint of the South, right? And really looking at public health in the South was essentially the essence of this presentation, right? When we talk about public health in the South, we know that those sort of health outcomes of people living in the South are driven by political, social, and economic disparities, and all those things come together to shape how outcomes end up in the South. Um, and within these outcomes, right, there's efforts that are involved by different players, and some of these players involve local CBOs and their jurisdictions, and local health departments, which they all play an extremely important role in addressing HIV. But because they're CBOs and because they're health departments, they often face many challenges, right? And if, sometimes those challenges are exacerbated by the size of the CBO, or exacerbated by the laws within these health departments in which they have to operate, right? But they face many challenges in order for them to be able to advocate for good outcomes for their communities, right? And just like CBOs and health departments play an extremely important role, and are implicated by by many challenges, individuals do as well, right? And because they are often also the ones that are closest to the issues needing to be addressed, right? They can also become the most powerful advocates for those issues, right? So it's important for them to be able to, as you see throughout the presentation, not only understand the issues, understand the landscape, understand the data and the science, but also understand that they themselves bring the power of the story in order to be able to sway and move stakeholders and lawmakers, right? And in order for us to be able to put all these things kind of together, it's important for us to understand the political context in which we are engaging in advocacy work. Oftentimes we talk about, knowing the issues is important, and that's certainly 100%. Yes, it is important, right? And it should be prioritized. But if we don't understand the political context in which we are working under, right, the political landscape in which we are operating in, it is harder for us to be able to push the kind of policies that we would want moving forward. So just a little bit of level setting, right? This is a map that was created by AIDSview to demonstrate the number of persons newly diagnosed with HIV in the South in 2021, but only from the perspective of the Ending the HIV Epidemic initiative, right? And within this initiative, of the 48 highest burden counties that were targeted by the EHE jurisdictions, nearly half of them are in the South. So on top of the issues that I demonstrated earlier in the previous slide, you also have this reality, right? And all that goes together to really culminate into what we see as political barriers in the South, right? Southerners have faced, and unless things change dramatically, will continue to face significant barriers that hinder public health efforts here in the South, and especially when it comes to HIV. And I think that those kind of things can be really associated to three major factors that we see throughout the South, right? Or major political barriers. The first one being conservative governance, and I'll explain that a little bit. Restrictive healthcare policies is the second one. And then the third one, I think, rounded it all together, is laws targeting marginalized groups, right? In this map, I really like this map because it really demonstrates the political landscape and the political reality that a lot of us face, or that we all face, right? But that we face in the South. Um, if you look at the map, it says that it's 40 trifectas nationwide. Now, a trifecta, for those that don't know, a trifecta is when a governor of a state is of a certain party, and then the House and the Senate in that state is in the same party as well. And then if you have a big enough majority of a certain party In a trifecta, then you have something called a veto-proof majority. And when that happens, that means that a law that is passed in the House then is then passed in the Senate, regardless if a governor is of a different party, that legislation will pass if they really wanted to, because it's veto proof. So we see a couple of those throughout the country, five of them being to be exact. But just going back to the trifectas, right? 12 of the 16 states in the South are Republican trifectas. And if we take a step back and try to understand, okay, so what does that mean? Well, the majority of restrictive healthcare policies that have been enacted have been, or not enacted, have been predominantly in the South. Of the 10 states that have remained from expanded Medicaid, right? Uh, seven of them are in the South, right? And many of them here are demonstrated by being under Republican trifectas. When we see a state like Mississippi, what does that mean when a state doesn't have Medicaid expansion? Well, in a state like Mississippi, you have people that are earning too much money to be able to be eligible for traditional Medicaid in the state of Mississippi, but make not enough money to be able to cover private insurance. And so they end up in this huge gap of not being able to be covered. So they're either uninsured or underinsured. Um, and certainly things like Medicaid expansion will go a long way in covering a lot of those people. Not everyone, but it will cover a lot of that chunk of people. You end up seeing that because of these policies being so restrictive, you end up seeing a lot more people being impacted by illnesses that perhaps would not have been had the state had Medicaid expansion. And that's an argument that can be had, but that's also a reality that we see, right? In the South, you also see, or at least in these Republican trifecta states, you also see a predominance of anti-LGBTQ laws, a predominance of anti-reproductive health laws, predominance of specific sexual and health education restrictions, and also you see a predominance of HIV criminalization laws. And these are all political barriers that people in general face in the South, and also people, of course, living with HIV. So as we are understanding the context um, in which we live in, it's important for us to understand um, our political context as well, right? Who our governor is, who our legislators are, who are the people that we vote for them, we send them to Washington. Who are these people? What are they fighting for? What are their stances? All that sort of information is something that you should be heavily involved in, especially during election season.
Yeah, so I mean, oh my gosh. Okay, so there's so many thoughts I have running through my head, and so many questions, but I'll start with just two. So with some of the southern states that you mentioned within those like Republican trifectas or that have that conservative governments that you mentioned, we've seen policies really targeting marginalized groups, including anti-LGBTQ laws that you mentioned. So what are resources or organizations that can help people in the South really stay updated on these policies and understand how, with this upcoming election and then also future elections, how that could affect them in their communities?
Hmm. I mean, this is a really good question. I think that overall, number one, I think going back to what I was saying earlier, understanding political concept, a political landscape is it should be prioritized as much as understanding the political issues that impact you, right? Um, but there's many ways to doing that, right? One of them, of course, is let's say you pick an issue that's of importance to you.
Mhm.
Let's say it's housing, right?
Okay.
And you want to see where your candidates, the ones that are running for this election, stand on that issue locally, right? But you also want to see what's what's the norm, right? What's happening right now. You visit your state government websites directly looking for that specific topic, so you could see what they're doing in your state, what sort of uh, what sort of laws dictate how housing operates in your state. And it's difficult to look, of course, through every single law that's going to mention housing. But what they have like these frequently asked questions, or just what is the state doing on housing, or what are the rules for housing, right? You can also look at local news outlets and look up that topic specifically just to see what kind of stories have come out uh, of issues, whether it be a whether it be a crisis or whether it be something a local politician did and the political fallout that comes from that, right? Whatever the issue may be, but I think it's important to look at local news outlets to just do your own research as you're finding out what's happening with housing in your community, right? But
Yeah.
also reach out to advocacy organizations, the organizations in your communities that are doing this sort of work already and are building support groups around it or building advocacy groups around it. Take your time out to volunteer if you can, or just reach out to them for information on their websites, or if you got to ask a question, they usually have a contact us kind of thing. Definitely find out from them because they're already in the trenches, they're doing the work. And so they would be one of the best resources to be able to get that information. When you're doing your own research, also, like, you have to make sure that your data is reliable, right? That you're getting it from a reliable site. If you're citing data and statistics, ensure that it's coming from official sites or organizations that dedicate their whole programming to that, right? An organization like Kaiser Family Foundation, on their site, you can find specific studies that have been made on this specific issue you're looking for. And it's really the information is really really palpable, really easy to take on, right? But also check out government sites like CMS if you're trying to find out about Medicaid. Well, they'll have these cheat sheets with, answering some of the questions, some of the basic questions that most advocates on the ground would have. Now, if you want more specifics, that's when you're going to look more into the legislation themselves or with organizations that are already doing that work. Never reinvent the wheel if it's already been made. Look at the work that has been done by others. And then one thing that I would say, I think it's important not only during this election season, but also in the following election seasons, because you have to continue to stay involved, continue to stay informed, right? I'm going to share some of those resources at the end, but I think like ones that come to mind for the general voter in terms of information, when they're information gathering from an election, or when they're just trying to find out someone that's been elected, what are they for, right? Sites like Ballot Ready are like really good resources. Ballotpedia, really good resource. Vote411.org is a phenomenal resource. And then sometimes these local candidates, they offer forums or town halls. Attend them. Listen to what they got to say. These places are also a good place for you to ask questions directly of them. And they'll get an answer, you'll get an answer, probably a political answer sometimes, but that's okay. At least they're engaging, right? It's worse when a politician is not engaging with their community, and that could be an issue of itself.
No, honestly, like you already took the answer or the question right out of my head when you talked about like resources to use for this upcoming election and really how to make sure folks are making an informed vote. So like that's really great to think about because I never thought about creating a plan or looking at the resources that other organizations are already doing or even going on Ballotpedia and trying to figure out like what's going on. So that's super helpful. So thank you.
I did want to mention though, there's other organizations doing amazing work
Oh,
that would love to elevate because they put together some um, really good, I guess, really good resources for folks, not only that are interested within this work of HIV advocacy, but also around public health as well. And one of those I would love to elevate would be AIDS United's Election Center.
oh,
It is full of resources for folks. I definitely encourage folks to check it out. It highlights some legislators as well. I think it's important. It's an important resource for anyone that's trying to find out um, anything about HIV advocacy and what's at stake in this election, right?
yes.
Another great resource that I've come across is the Black Voters Guide from United We Rise. The way that report was put together, I gotta say it's amazing, right? You got the issues out of front, what's important, and then it goes into, how can you ensure that you vote, right? And then it goes through this checklist of stuff, and then it provides even more resources at the end. I thought that the way that was put together was great, and you can find it online at United We Rise. It's their Black Voters Guide. You can Google that. It's just amazing. But
Yeah.
they're not the only organizations doing that. ACLU, I know they do some local stuff as well. You know, they have this ACLU voters guide for Texans. So, you know, because the ACLUs are all state-based, you know, it's a national organization, but they have their state chapters. I guess every state will do things differently, but the ACLU of Texas put down these things. This voters guidance is amazing. Human Rights Campaign is the last one I'll mention. There's others, but Human Rights Campaign is the last one I'll mention. They also put out some really good voter guides, especially for prioritized communities like LGBTQ.
Hey, I mean, you're dropping resources I didn't even know was out there, and I feel
Nice
like
notes, people.
you know, so thank you. Please, folks, listen to Will. Like while you're carrying on in this presentation, go ahead and pop up another window and go look up some facts. Make sure you're planning out your voter plan because, you know, sometimes you might need to multitask, or like me, now I need to go find these extra resources I didn't know was out there. So please stay tuned, keep looking, and we'll also drop them at the end of the conversation too. Thank you.
Yes, absolutely. Now, like I'm gonna continue now with the presentation. I really want to show you this next part, and that this is, you know, adapting to political realities. We understand, especially in the South, that things work differently here. If we go back to that, you know what, let's go back so I can show you what I'm talking about. I don't even know if I mentioned it earlier, but if we look at the map right here, we see that the state of New York and the state of California, they have Democratic trifectas, right? And so when advocates are pushing for legislation in these places, there's approaches that they take to be able to influence their legislators to pass the kind of, you know, beneficial legislation for people living with HIV or those impacted by it, right? But they have Democratic trifectas up there. One cannot take the same approach in the South because it will not work, right? And so there's a need to take on strategic approaches in the South that involve many different contexts. Because like in the South, we don't have democratic trifectas, right? In the South, we need to be able to work with our colleagues across the aisle. We need to encourage bipartisanship and collaboration because that's the only way that legislation passes, or progressive legislation for people living with HIV or those impacted by it, right? So just like CBOs and health departments, they need strategic approaches to work within restrictive political environments in the South. So do individuals. They also need to find ways that are strategic to be able to advocate for change within their restrictive political environments that they live in the South as well. And they do that through well, you know, individuals do that through using your voice, using your vote, and using your network that, you know, to be able to influence public health decisions, right? And that network is either your personal network or your professional network, but it's also your network at church, right? It's also your network with the fellow parents in which you pick up your kids, right? You have a ton of networks that are available to you that sometimes we don't engage in or engage with, um, you know, for whatever reason, but you know, those things are available to you, or perhaps may be available to you within your own advocacy as well. You know, but as you're doing that, as you're analyzing this, as you're you know, looking at your individual approach, always ensure that you're aligning yourself with, or aligning your advocacy with science, right? Make sure that your efforts are backed by scientific evidence, much like how health departments base their decisions on 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 scientific evidence. You should as well, right? Um, Also taking the information like data. Also, data is important for you to be able to take on. But as an individual, there's something that you have that others don't, and that's your own personal story. And when being an advocate, having the data and having the science is important as basis, but you need to be able to also have a story, right? The storytelling aspect is an aspect that many people talk about, um, and some people emphasize, but I think it should be really, really emphasized in the advocacy work, especially when you're engaging with policymakers and difference makers and stakeholders, right? That your story is as important as the data and the statistics that you bring in order to be able to influence folks. Um,
Yeah.
And then also, yeah, I'm sorry. Go
Oh,
ahead,
no, no,
Brady.
no. I'll cut you off. Well,
No, it's good. And I
I
was
was
going to
in
say
it.
the
I
last
was
part
in
of
it.
that. The last part of that, what I was going to say was that understanding political complexity um, is highly important, right? Th that political decision making is going to be influenced by many different things, including the science that you're bringing, right? When these policymakers are making their decisions, they're influenced by many different factors, and what those factors are things like economics, they're things like public opinion, like party politics, and we see some of those being uh, vehicles that sway now politicians a lot more than perhaps before, right? This age of tribalism in which we live in which party politics overall, right? So I think it's important for advocates or potential advocates to keep that in mind, right? To keep that in mind when they're growing in their advocacy. Stay informed, stay aware of how all these factors play, excuse me, they play a role in public health policy, and then tailor your advocacy accordingly. Now, this doesn't mean change your messaging or just change your values. What it means is understanding the landscape in which you are engaging with and framing your policy to fit that, right? To find a way for you to be able to communicate your message more effectively. To give you an example of what that looks like real quick. Um, there was there was an, I met with a legislator earlier in the year, me and another advocate, right? And this legislator was out of a state, I would say Oklahoma. Well, because it was Oklahoma. And for those that know or those that don't, I'm based out of San Antonio, Texas, but I'm not originally from the South. I was born in the Bronx, right? So in the introductory phase of this meeting, right, we're all getting to know each other with this legislator, I mean, with the staffer of this legislator, myself and the other advocate. Um, they ask me where I'm from, and I say I'm from New York, and I get a bad look, right? Like, what are you doing here, right? What are you, what is it that you're doing in my office, right? And so I see that reaction, and I respond with, but I'm living in Texas. I'm thinking that that's the fix. I'm good again, but no, that stare became a glare, and it got much worse, right? I didn't understand at the time the dynamics of the relationships between Texans and Oklahomans, and I didn't know that was a thing. And so luckily I was with a local advocate from Oklahoma who was able to interject and really calm the waters by talking about tailgating certain colleges and the kind of football parties they had and just the celebration around, and they spoke about some other local issues or local things that they're both fans of, and just really changed the atmosphere in that room. Had I been there by myself, the advocacy session would not have gone well. I would have spewed a lot of data, a lot of science, but it would have gone on deaf ears because there was no connecting there, right? There was no connection there. And what that advocate did was able to just also replicate the message in terms of the data, in terms of the science, but they were able to bring in their story in a way that made it palpable to the staffer and made it a good time, a good conversation between them. And the message was heard. Whether or not the legislator in which this staffer works for votes the direction that we want them to, that's those are ongoing efforts. But what that did, if the relationship went well, or the meeting went well, that's a potential for a next time to be able to sit down with this person again. Had I been there by myself, they probably will cancel my next meeting and not meet with me, right? So like these kind of things are important. Relationships are important, and understanding the political complexities of where you're engaging in is extremely important as well.
Yes, and with that, like, no, that's such a great example. I didn't even like stop to think about it. We could clown, the Bronx for other reasons outside of like, you know what I mean, for policy, but like that really, I wanted to like reiterate a point you made about like understanding your policy landscape and then forming your policy. And then like you added another layer of like really just understanding the people and the audience you're going to interact with and how to create those type of connections and networks. So I think for this election, we're talking about voters should be preparing to understand their landscape, get their plan together. But also, what should voters look for in candidates who support these kind of partnerships in their communities? Like, what should be a thing that they should like call out or be able to look at? Like, hey, this candidate is doing this. I can align myself with this because I understand, the first three steps that we've been talking about, my landscape. Now I know where my informed policy is. How do they find candidates, or what's the next step to really make sure that they can make partnerships in community and those candidates also have partnerships?
That's a good question. I mean, I think Ballotpedia is a great resource to be able to find out who are your current legislators, right? And then from there, you can through Ballotpedia, you can check what are they for, what are they against, right? And that helps you and actually the next part of this presentation. And let me share my screen again so I can kind of show you. Um, and it's really what can you do as an advocate or as a person that wants to be an advocate, right? And once you do the research of what they're for, what they're against, and you're getting ready to craft a message or sit down with them, I think it's important to consider, like I said in the previous slide, these non-scientific factors in decision making that this legislator is going to be involved in when you're telling them your story or when you're advocating for your cause. What are the different things they may be considering? Either to tell you I'm not going to go that way, that direction, or I am going to go in that direction, or I sit in the middle and I'm waiting for you to convince me otherwise, right? Um, it's important to consider these non-scientific factors. But it's also important to get involved locally and encourage others to vote, right? Especially during this election season. Getting involved locally really just means getting involved with what the local legislator is up to. Sometimes they hold town halls, getting involved in that. Getting involved with community organizations that are either already doing this work or need help amplifying this work, getting involved with them, right? And, just ensuring that you are doing this work locally and understanding your own community in order to be able to sway efforts in any sort of direction, right? And always encourage voting, because encourage voting is part of the long game. Because as you're getting involved with the legislators now, or you're encouraging getting involved with legislators or stakeholders today, uh, within the current political landscape, you also understand that it can potentially be a better political landscape if certain people are elected in the future, right? So always encourage voting to be able to be working that long game to make your work easier when you're engaging with your local legislators. Because if they're not pushing for legislation that's going to improve your communities, then it needs to be voted out of there anyway, right? So one thing that I will emphasize though, 100%, especially if you're in the South, especially if you're engaging with legislators in the South, is to avoid partisanship, if you can, of course, right? Avoid partisanship and encourage bipartisanship. We need to go back to an era of where these sort of policies are debated and not necessarily ostracized, where we pick and choose which are the best factors or best parts of a policy to be able to improve people's lives, right? As opposed to just negating that is an improvement on people's lives in the first place, right? So going back to an era of bipartisanship, it starts with the population as well, not only with the legislators up there. Because if you were voting people in that encourage bipartisanship, then it pushes those people out that don't, right? Either it forces their hand to be able to be more bipartisanship because they are part of the minority, sense of opinion, or get voted out in the first place. So it's important to always think long game and think what you can do today. Educate yourself on the issues and know that personal actions matter. What you're doing to push on the issues, people are seeing, your family is seeing what you do, the church that you attend, they're seeing what you do, the barbershop is hearing what you're talking about. What you do and how you talk about the passions for other people and improving people's lives, or improving your own life through policy advocacy, what you do matters, and people see that. And that in itself is also advocacy, even if you're not directly talking to folks. And going back to that story about that staffer from that legislator from Oklahoma, it's one thing that I learned from that meeting. The lesson that I carried from that meeting is always be aware of the right battle that you choose, if you're choosing the right battle. and also choosing the right messenger to fight that battle. I was perhaps not the right messenger in that room. And if I was the only messenger in that room that day, that message would not have been delivered, right? And choosing the right battles, sometimes we're pushing for legislation that is beneficial to our communities, absolutely. And we're pushing more than one, right? One of them passes, another one fails. And then the example I want to share is one from Louisiana recently, where they had two bills that would benefit people living with HIV or those impacted by it, right? And that was the HIV decriminalization bill in Louisiana and also the PrEP expansion bill for pharmacists to be able to offer PrEP out of community pharmacies, right? The one that passed was the PrEP expansion bill, right? The HIV decriminalization bill did not pass. Now, the HIV decriminalization bill, though, was monumental in ensuring, or at least assisting, in the PrEP expansion bill to pass. And the reason for that was because the champion in the PrEP access expansion bill was a person that got involved in learning more about the impact that HIV has on communities through a study that was mandated by the state on the impact of HIV on criminalization. Him being part of that study learned more. He learned more about HIV and the impact that it has on communities, which pushed him to be a champion for that other bill. Now, the HIV decriminalization bill did not pass this time around, but there's a good chance that it passes the next legislative session, right? And I think that's how these kind of things operate, that these are not things that you can expect a change overnight. Some of these efforts take time, but it is also important for us to take a step back and realize that not all victories were had, but some were, and those should be celebrated.
No, yeah. I don't know. Being part like avoiding partisanship is definitely very difficult. I feel like but when you put it in that perspective and really gave that roadmap of like making sure you're aligning with your personal issues and like almost in a collaborative spirit to like work with folks and to engage with folks and also to have the moment to recognize that you might not be the messenger. I know that I can't be in a room with just about everybody yet because I need to, channel, where I'm at in my policy stage and my advocacy stage in life. So that's really good. Especially for the viewers, folks put in the comments or chats, like, have you ever been in a situation where you had to like reflect and recognize that maybe someone else would have been a more impactful messenger, or maybe this advocacy decision or this policy decision could have been better if we had a different candidate. Like we've seen it right now about the moving of candidates within the election. So let us know your thoughts. Put it in the comments, y'all. But thank you, Will.
Yeah, absolutely. And definitely put those comments down. I want to read them. I want to see what you're thinking. And so I want to continue now with the presentation because I really want to talk about the collaboration aspect in these challenging environments that we find ourselves oftentimes in the South, right? And I think I broke it down into five different parts of it, right? The recognize, the partner, the build, the act, the strengthen. And I really want to take my time really going through them and hopefully I can get some feedback from folks in the chat or even emailing us on what do folks think about that, right? So starting off from the first one is recognizing intersectional issues. Is that's the understanding that public health challenges are deeply intertwined, and they're deeply intertwined with social, with economic, and political issues that oftentimes we see them as show up as housing, show up as poverty issues, or even systemic racism, right? And understanding that these intersectional issues exist is a prime way to get started into being able to partner with local organizations, to be able to collaborate with local advocacy groups, nonprofits, and public health agencies, so that you can be able to pull resources within a community or pull knowledge within a community to become better advocates of a specific issue. So not only are you identifying these intersectional issues or by using intersectional lenses, right, where you are identifying that multiple avenues can attack a certain issue, right? You're then looking to partner with local organizations, maybe ones that have already been doing this sort of work, or others that you see that perhaps can be brought into this work that don't necessarily belong to the sector in which you're already engaged in, right? And that brings you then to the next one, which is building cross-sector relationships, right? You want to be able to engage with professionals and non-professionals from various fields, right? From healthcare, from housing, from education, from community organizing being key because these are the people that hold the keys to be able to engage with community and get them mobilized to a certain issue, right? So they could be able to address the root causes of public health disparities. And that kind of brings it back to that morning coffee question that we had, right? What would be the best policy for me? It would be one that really incorporates this, right? Really incorporates the social determinants of health, right? To address these root causes of public health disparities. And the next one I think is important, and it's important for individuals to really understand this, because as an organization, SAC likes to say that we are both a bridge and a megaphone for folks, right? We are a bridge for them to be able to connect with other organizations, other advocates, their legislators, whoever it is that they feel they need to be connected to. If we can, we facilitate that, right? But at the same time, we're also act as a megaphone to elevate the efforts, to elevate the issues and the ills of our communities in the South to places where either they're not being heard or not being heard enough, right? And so just like organizations can act like that, we as individuals can also act as a bridge. Because as an individual, you can excuse me, you can connect, uh, you can help connect different sectors and stakeholders who may not traditionally work together, right? You can engage with someone at your church and get into a conversation that you realize that you had with this CEO or this executive director of this other organization where they were looking to collaborate with somebody that spoke about things that this person spoke about. That's a connection right there. And you can be that bridge that advances this sort of collaborative work. So always see yourself as a potential bridge for folks if you're not the one doing the work yourself. Because another thing to understand in this work is that you cannot engage in this work by yourself. Engaging in this sort of work by yourself is exhausting, and really it's not sustainable. And so the only way to get these sort of efforts moving forward is to work in coalitions, to work in collaboration with folks. And the bigger the coalition, the bigger the collaboration, the better, right? And then that brings me back to the end one, to the last one, which is strengthen community networks. By collaborating with other individuals and community leaders, to create a sort of united front that addresses issues both local and also systemic ones that influence public health barriers for your communities.
I mean, Will, like you're just dropping so much knowledge on people. And I think that's just something that I don't even sit and think about. Like, even everything is just connecting so well. It's like recognizing, choosing the right messenger, but also being a bridge. You might not be the messenger and the person to relay the message, but you could be the connector that brings two organizations together to relay a message. Like, we all play key roles and key parts into this. So it's almost like in the process of understanding where we are landscape wise and recognizing that we're in conservative spaces, but also that we can move and navigate through them effectively is something I never thought about. I always thought it's like us against the world. We're fighting to end the epidemic, just trudging along, but not recognizing that there are so many different outlets and areas that we could be tapping into. So thank you for that. I appreciate it.
No, absolutely. And it can be overwhelming, right? And
Mhm.
and that's why this work is so important for us, for people to be able to lean on each other as you're going through it, to collaborate with folks, because it is a lot of information and it's a lot of complexities, and it can be
Mhm.
very elaborative. And not one person has to hold all the answers. By collaborating with folks, you're able to learn from each other, you're able to, have strategies to be able to tackle this sort of issue a lot easier, right, than you would by yourself. That old adage, or one mind, I mean, two minds are better than one. It's
Mhm.
certainly true in this work and any sort of collaborative work. And so that brings us into the next one, uh, which is really just a step, political strategy, or building political strategies for public health, right? And all the things that incorporate that for individuals specifically, right? And so I'll start off with this big one. And then I'll go deeper into that one, into this one, in the next slide. But building relationships with legislators is key. It's key because connecting with your local representatives, and being able to communicate your public health concerns is something that really moves the needle forward, right? Even if it doesn't do the, even if it doesn't do that that day, we've seen in this work that the constant push, even against people that you normally would not see as your allies in this work, sometimes end up moving them enough so either they don't show up to vote or they vote in your favor. And right, and both of those statements are huge. Of course, you would want them voting in your favor, but sometimes it's not politically expedient for them to vote in your favor, so they just don't show up. Not showing up is as an important statement of allyship and solidarity within these movements. That one, building relationships, that happens because of that. Um, well, those outcomes happen because you're building good relationships, is what I meant. And then, you want to be able to follow up regularly to build sustained relationships and keep the conversation active. They don't have to agree with you at first, but sometimes you're able to sway them enough for a good outcome. Also, the timing and the framing of health issues, you want to be able to have those kind of things to resonate with policymakers. If there is a constant conversation within your state's legislature of constant debate around Medicaid expansion, then you know that is a pertinent issue to attack, because what you're doing when you're showing up, you're either presenting points where they can both agree on, or presenting points as to why this needs to happen, and perhaps you can influence those that are opposing the passage of this to be on the same side of it. So it's important to be able to time and the frame to be able to time your efforts effectively. Messages like, and these are old messages, but they're still true. Like HIV prevention is a cost-saving measure, right? Prevention strategies save money for the healthcare system. This is a known fact, right? And so amplifying that message, it's an old one, but it's also one that is always current, right? And then of course talking about the monetary benefits of expanded Medicaid. What does that do for a state, right? Especially after the passage of ACA. What are the benefits that come for a state participating in the ACA or in the Medicaid expansion, right? Understanding your power, it's so important, right? Because the previous 2 points are the same points that you would give, or I would give in the presentation to CBOs and health departments, right? Because they are also engaging in this sort of things in many different ways, but they're also engaging. They also have to build relationships, right? And they also have to time and frame their issues, right? But understanding your individual powers, where this changes, where this shifts, right? You as an individual, you can influence public health policy through direct political engagement with your legislators, with your administrators in the state. You can do that also by voting. You can contact legislators. You can keep in continue communication with them, just as a concerned citizen, right? So these are things that are available to you with no sort of restrictions that you can engage in. And you can also participate in town halls, which oftentimes they're open, sometimes they are not, depending on the politician, depending on the tactics that they're engaging in. But most of the time they're open. And then so participate in them, right? Build up a sustained momentum, because the advocacy requires that. Advocacy requires consistent action, right? So you need to stay informed of legislative changes as best as you can, because these sort of things sometimes, I understand, they're difficult to follow, but as best you can, or framing it around the issues that you care about. Housing for people living with HIV. If you frame it as something as simple as that, you can follow legislative changes that go on with that, anything that pertains to housing for people living with HIV, right? You don't need to uh, to make your work a lot more difficult than it has to be. You want to follow up with your policymakers as a way to sustain momentum. And then encourage others to join in your advocacy effort. I know that's sometimes it's difficult to convince others, but when you're doing good work, it's easier to talk about how good the work is, right? It's easier to bring people in. So definitely talk to people about joining efforts when you're at a high, because that's when you're able to convince folks easier than when you've just got defeat after defeat and you're down. It's hard to convince folks to join a movement when you're down. right? Because nobody wants to just willingly get themselves down, right? And of course, participate in, if you can, and these are great tools, participate in advocacy training programs to be able to equip yourself with the necessary skills to by joining workshops or programs that are going to teach you effective advocacy strategies. I lay some out, but those are not the only ones. And if you want to really engage in this work, there's organizations out there that provide this sort of training. You can also reach out to Southern AIDS Coalition to see how we can help with that, how we can help your organization, or how we can help a group of individuals attain this sort of training. So please, put something in the chat or reach out to us. We'll provide our emails at the end. Let's see. Do you have something for me before I get into the slide, Brady?
No, honestly, I think I was looking for all right, so I need step by step, but you have it. Here's the roadmap. Thank you. Help me, please.
Okay. So, in the previous slide, I spoke about identifying key stakeholders, right? Or building religious relationships, sorry, with legislators is key. That was the first point I identified in the previous slide, and it goes over to this one, because really that's one of the key drivers to getting into this work, right? You want to identify who your key stakeholders are for the legislation that you're either fighting for or for the kind of issues that you think are important. And that's really understanding who holds influence over public health issues you care about. And that's going to include your local legislators, your local representatives, if you have a city council in your city, community leaders that are leading the charge against detrimental policies or leading the charge for beneficial policies for the community, right? These are the place where you're going to identify who are all the players, right, in this work. This is going to help you to see who you're going to join, if you need to join somebody, who you're going to reach out to, if you need to send a letter to someone, and who you need to vote for or against in the next election, right? So that's the first part. Some people call it power mapping, and it's really just identifying who's involved in all these decisions, right? The second one, it's engaging with the broader community. Some people like to do this a little further. I think it's important to do this early on, just to kind of put feelers out there to seeing who is involved in the kind of work that you're looking forward to, or who's already engaged, and who's interested in engaging, right? Even if that's just at the beginning. At the beginning is most of the time when advocates are at their most passionate. So engaging folks during this time is a good idea, perhaps. The next part I would say is that knowing your political landscape, and some of the tools that we identified during the slides kind of help you with that, to get you started on that. But that involves, of course, again, researching your candidates, researching what they're for and against. That includes also policymakers within, let's say, a new director of public health has been hired at your local health department. So what are they all about? Where do they come from? What are the kind of stuff that they would push? That's kind of stuff, the kind of stuff is important to you because sometimes they release language that may not be beneficial to you. And then the next legislative session, a bill passes based on the language they used, and now you're in a worse situation, right? Track their stances on public health issues and pay attention to campaign promises. This part is deeply important because sometimes they make promises and they don't have ways to be able to get it done, or they don't even present ways to get it done, potential ways to get it done, right? Like concepts of a plan. And so how health is framed in debates is extremely important. So knowing the political landscape, I would say, is the third step in this roadmap. And know that the roadmap will take time. This is not something quick. This is something that takes time, but it at least allows you a path to follow so that you can be better acquainted with the issues that you're fighting for, right? The next one is conducting background research. And Brady, please interject with any questions you may have along the way, because I know I'm taking my time with each one of them, but I really want people to understand how they're all different, right? So with conducting background research, it really just means investigating the sort of public health challenges that exist within your community, and then how you're going to align them or aligning them with existing policy conversations. That's something that kind of said earlier with the Medicaid expansion conversation. If Medicaid expansion is making the news in your state, a lot, right? And you hear, oh, there was a hearing held by this party this day. There was another hearing held by this party the next day, all around the same topic. That means it is a hot topic in the legislature. And if that's a topic that is important to you, then engaging in that conversation now is that time is right? It's the time is now. Um, so that's how you investigate public health challenges in your community, understand them, and then of course aligning them with existing policy conversations. So conducting that background research is important. And then often we don't engage early enough, and then we don't engage often enough. So don't wait until election day. You want to start conversation with candidates. And right now we're a week away. So I'm not telling you, go ahead and start this conversation, go ahead and start this relationship today. That's not probably gonna roll well, just because they're so busy. Everybody's just looking forward to next week. But after this election, definitely engage in this sort of work. Start conversations with your candidates and elected officials, especially if they're new, if they're just been elected for the first time into this position, right? Definitely reach out to them, because you can start or trying to influence them early into proposing the kind of policy that you would want. So you do that by attending events, asking questions, voicing your concerns about public health or whatever it is, other issue that is of interest to you. When you've reached out to everybody or reached out to some folks, as you're also engaging early and often, as you're conducting the background research, you also want to be able to build a shared agenda with the other stakeholders that are part of this grouping, other collaborators that are part of this coalition. You want to be able to collaborate with stakeholders to develop a unified agenda that addresses the most critical issues that you want to have addressed, right? The quicker you do that, the better, because when a coalition happens, they often have a collaborative approach where everyone is coming with their own bias and their own interests, right? And they're unifying around a specific interest that they're all going to fight together, right? Building that shared agenda is extremely important in order to get any sort of work like this across the line. Together, once you build this shared agenda, you'll be able to frame health issues in ways that resonate with decision makers, and that's when you prepare a compelling speech. Sorry. For example, so highlighting the cost-saving benefits of HIV prevention over not taking that direction, or the expansion of Medicaid, or this is where you craft a compelling narrative from your lived experience, right? All happens in this phase. After you've done that, you've built your grouping already, you have your folks, you understand the political landscape, you understand the issue, you build narrative around that issue, then you schedule a meeting. And after you schedule a meeting with the staff, or if you're lucky, with the legislature themselves, that's when the building the long-term relationship starts. If that meeting went well, you're a head start to building that good relationship. If it didn't go well, it doesn't matter. You're still on that path. So keep going at it. Keep meeting with them, right? Because if they're your legislator, they're supposed to meet with you in the first place because they're your legislator, right? Also, offer ongoing support and resources. You've been doing a lot of research. You've been doing a lot of fact finding. You've been compiling a lot of data, a lot of science. Share that with them, right? You told them about it, but leave some information for them to review, right? Because then at that point, they'll have the narrative, how you delivered the data and the science, and then they're going to remember the narrative more than the data and the science. And then the data and the science there in front of them for them to be able to connect that, right? So you want to have that. You want to have that. Almost there, almost done. Monitoring progress and providing feedback. Tracking the progress of policies that you've been pushing for, as easy as looking for that specific policy in the jurisdiction and who voted for it if it came up for a vote, right? Looking to see if the person that you spoke to, if it made a difference, your conversation with them, right? You could have been one of 100 advocates talking about the same thing, but if they voted in a direction that was beneficial to what you were trying to fight for, you don't know if it could have been you. So take that as a win, as if it was you, because you were part of those efforts to be able to convince this person, right? So track these policies you advocated for and provide updates or feedback to stakeholders or the broader community or the coalition you built. If you're the person checking on it, give updates. Hey, they just voted on this. Celebrate that together. Small victories, even if making it from one chamber to another or making it out of committee, that is huge, right? Because that is forward progress, and that's what we want to see with beneficial legislation. The last part of it is building long-term alliances and making advocacy year-round. Understanding that you need to be able to continue to foster partnerships if you're working with folks, and if you're collaborating across sectors. Everybody, remember, has their own agendas. So you want to be able to continue communicating there and understand that advocacy is ongoing and it's not at all limited to election cycles.
I'm glad this is an ongoing process because the way my brain is marinating on all of this information you just gave us, I really appreciate it. So, Will, you definitely hit so many different ideas, especially within even building up your political strategy and recognizing who to engage with and like how to create a shared plan. But I think kind of where I'm at now, outside of letting this process is like what additional resources and efforts can people use really to not only form these local partnerships, but also engage in policymakers in their area going forward. Like we know next week's the election, so shameless plug, the first thing everyone should be doing is voting. So I
Right.
hope, that was understood, y'all. Go vote. Thank you. But what other resources and additional efforts can people do to get involved?
Yeah, so I mentioned some of these earlier, but I think I'm just going to highlight them again because I think they're important. And they're also work that our colleagues are doing in the work, and I think it's important to elevate the work of our colleagues because so much organizations are doing such great work. And I think it's important for everyone to get their flowers for the amazing stuff that they put out, right? So let me go ahead and open this back up just to share these. So the first one I mentioned earlier, the election center by Age United. Did I take it off?
Oh, the black
Yeah,
ones.
there you go. The election center by Age United is a great resource. It gives you a ton of information. Please check them out, especially if you're interested around the issues around things that impact or policies that impact people living with HIV or those impacted by it, right? The next one I would say is the Black Voters Guide by United We Rise. I was thrown aback by how complete this report was, in the way that the information was presented in such an easy to read way, and it really provides impact in such a short pamphlet, right? It's just a few pages long, but within that, there's a ton of information. It starts off by just giving you the issues that you should be paying attention to, as a Black community. And those are like what to watch out for in this election, right? And then it moves on to understanding how to vote, right? Whether or not where to go to if you're not registered, or if you don't know if you're registered. Where to find out where your polling places are. If you want to vote early, where in your county can you find that? So all those kind of resources, you'll find them in those in that guide, as well as some of those resources as well in the election center. Both do very well in terms of putting all these things together. If you want to research who is running and what they're for, check out Ballotpedia by the name of the person that you are researching, and they'll have all their stuff there, at least most of it. Some Ballotpedia pages even offer direct quotes from the legislators if they provided commentary on some of the questionnaires that were sent to them. So that's really good information because then you're able to hear from them themselves, what kind of issues that they advocate for or they oppose, right? Ballotpedia is also a great place if you're tracking state amendments or state ballot measures. You just look up ballot measures, Ballotpedia, and it gives you a list of all the states that have them and an explanation of each one of them contained within each state. Those ballot measures are specifically written in a way to confuse you or to confuse the layperson as they're reading them. And even people that are schooled in policy sometimes find it difficult to read through them. So it's important to find the resources to just simplify the information, to make it more accessible for us as voters to vote the way that benefits us the most, right? So those are three resources that I want to leave with everybody. Definitely check them out. Again, put questions in the chat and also reach out to us. through our, contact us on our website, sign on to our newsletter, um, or just engage with us in general.
Yes, so one, let's all give a round of applause for Will. Thank you so much. This information is so necessary and so crucial, especially with this upcoming election and just overall how we become better advocates in a world where advocacy is needed. It's consistently needed and growing and ever changing. So, like, just to reiterate, folks, remember to learn your policy landscape, learn what's going on in your state, like Will brought up, like learn the conservative policies in the area or the restricted policies that are affecting so many marginalized communities. Make sure you're building out a strategy, your own shared plan, so you can get out there and vote. I don't know how many times I'm gonna say this. Y'all gonna get sick of me. Vote. Okay. And also start developing a political strategy with organizations and policymakers in your area. Know your audience. Make sure you're choosing the right messengers. Also, recognize the impact of bridge building. Build those coalitions, connect. You might not have to be the speaker, but you can be the connector. You can be the bridge. So please make sure that y'all are learning, developing a shared plan. Please take these strategies to heart and continue to use them. Also, any other additional resources and programming we also have available at SAC via our lunch series. Make sure to continue to check us out. Also, our Woke Wednesdays, where you'll be also joined by Will again, who will be dropping multiple nuggets of information for you so we can keep these conversations going. And with that, I want to say thank you all for attending our webinar this afternoon. If you have any questions, as Will mentioned, make sure to drop them in the chat and we'll be sure to follow up and answer them. And also, please make sure to follow the Southern AIDS Coalition on all of our social media platforms because we look forward to continuing to having more conversations with you in the future and also just engaging with y'all. Thank you so much. Go vote. And y'all have
Thank you, Brady. Thank you, everybody.
thank
That
you,
was
Will,
awesome.
so much. Thank you.